All right, Arpan Prabhu from the University of Pittsburgh. Reddit and radiation therapy, descriptive analysis of posts and comments over 7 years by patients and healthcare professionals.
Hi everyone. We're all consumers. We all take pills in the form of social media throughout the day. I see it all the time when I'm in line for Starbucks. People are on Twitter, people are on Reddit, people are on the Red Journal website sometimes. Our patients are taking these pills as well, and I was interested in seeing what they're seeing about radiation therapy on Reddit, and if there are any physicians on there that are talking with them on Reddit as well. So this is a screenshot I took of the cancer subreddit yesterday. We looked at this subreddit because it had the most amount of users compared to the other smaller subreddits we found in breast cancer and prostate cancer. So subreddits are within the larger community of Reddit. With each subreddit, there are multiple discussions going on. You can get involved in like 3 different ways. You can produce content, you can comment on that content, or you can just be a moderator and just watch and see what's happening. The things I love about Reddit is that you can have multiple discussions on one thing. So each comment can have its own discussion thread. You're not limited like Twitter to a certain amount to a few amount of characters. You can have up to like 20 or I think 40,000 characters on Reddit. You can be anonymous, kind of like SDN, so that gives you more leeway in discussing and being yourself on there, which can be good or bad. So the purpose of the study was to characterize discussions on the cancer subreddit about radiation therapy and identify interactions between patients and their healthcare providers. We took 20 different search terms on the cancer subreddit, listed them all there. We identified all the posts over this time period. We found about 190 posts by 178 users, and we looked at the top 3 comments that were posted for each of these posts. Then we coded and analyzed them with 2 different reviewers, a medical student and myself. We categorized them based on those things below, and then we analyzed it in facet comparisons. So looking at the most common post themes, this is a word cloud where the larger word is the thing that came up more often. As you can see, the most common post themes are related to treatment questions, toxicities, and social support. Particularly with the treatment questions, people tended to give longer type narratives about the experiences they were having, sort of like an HPI. And I think that was really interesting because it was a way for them to give more details about their experience that Twitter might not always allow you to. And it was also interesting to see how people responded to those comments. A lot of times giving sort of support, and occasionally you're having healthcare providers chiming in with information of their own. Here are a few of the comments that healthcare providers and one by caregiver provided. There were few healthcare providers on the website for the cancer subreddit. We had about 10% of users were healthcare providers, and these were self-identified healthcare providers. But whenever they did post, they were 25% of the highest voted comments and 50% of the top 3 comments, which is very interesting. I guess I can read one here. The radiation therapist or radiotherapy treatments with CyberKnife, one of the most precise treatments nowadays. Things like that. Healthcare providers could be anonymous and provide nuanced responses. They could identify themselves as a provider, but not where they work or who they are. These are different ones that self-identify themselves as a neurosurgeon, pathologist, radiation oncologist who also work in healthcare. There weren't specific modalities mentioned very often. I think less than 30% of posts mentioned specific modalities, but whenever they did mention it, proton therapy was the most common one. It's probably because of the increased attention it's gotten recently, whether it's in the news. So in conclusion, we looked at posts about radiation therapy on the cancer subreddit. We found that 10% of users were self-identified healthcare professionals, but although they didn't comment that often, when they did, the patients and audience on Reddit really appreciated it and voted them as high comments. Reddit is a very popular social media site. It's one of the top 5 social media sites in the world and gets more traffic than Twitter and Tumblr. So it's definitely a site that patients are going on, and probably yourselves if you enjoy social media. Next steps, I think that Astro has been kind of pushing this healthcare social media initiative, and healthcare providers should consider adding Reddit to the repertoire. Traffic's only going to increase on there. You can become verified on Reddit if you want to, and conduct these AMA threads, Ask Me Anything threads, provide evidence-based discussion, and just become more visible. Thank you.